Moving on to question number 3. Which substance increases the nitrogen excretion in the urea cycle disorders? And your options are phenyl butyrate, phenyl acetate, isoleucine and carnitine. Now this is a very simple but tricky question. I'm sure most of you are able to quickly eliminate two options, that okay, it is not isoleucine, it is not carnitine. We have to choose between phenyl butyrate and the phenyl acetate, and most of you will say, sir, we are going to give the phenyl butyrate as the drug for increasing the excretion of nitrogen in the urea cycle disorders. This is correct, but what you have to remember that phenyl butyrate is actually a prodrug. It is a prodrug. The phenyl butyrate is first converted into the phenyl acetate. Once the phenyl acetate is formed, it will then combine with the glutamine and thereby it will form the phenyl acetyl glutamine, which is the excretory form. So what you have to remember, it is the phenyl acetate which is the active molecule. Phenyl butyrate is the drug that we give, but it has to be first converted into phenyl acetate, after which the action can be there. So the substance which increases the nitrogen excretion in urea cycle disorders is actually the phenyl acetate and not the phenyl butyrate. Phenyl butyrate will be the prodrug. So if you get a question on the prodrug, there you can mark the phenyl butyrate. If phenyl acetate is not there in the option, then you can mark the phenyl butyrate. But if phenyl acetate is there in the option, then it is definitely the better choice that you have to select. A similar option would be the sodium benzoate. The sodium benzoate, where you have to remember the benzoate part will combine with glycine and thereby it will produce the hippuric acid. Both the hippuric acid and the phenylacetyl glutamine are readily excreted in the urine. They are filtered, but they cannot be reabsorbed because we don't have transporters to reuptake the phenylacetyl glutamine or the hippuric acid, and they are completely lost in the urine. So two molecules which can increase the nitrogen excretion in urea cycle are the sodium benzoate and phenyl butyrate, the prodrug, which gets converted into the phenyl acetate. The two molecules which help in the excretion of nitrogen are the phenylacetyl glutamine and the hippuric acid. Very frequently you will get the question on these 2 points.